Hello, my name is Romero. I'm the Physiotherapist of Facialteam and I'm in charge of the lymphatic drainage massage. When you get back home from Marbella, there are a few things you can keep on doing to help to decrease the swelling. These are the tips I give to all my patients after the surgery. The first of all is to drink a lot of water. That's going to make a big difference. It's going to make the lymphatic fluid thinner and easier to remove and drain. The second thing is to walk. Walking is the only exercise you are able to do in the first 6 weeks, so it's something important you have to do because it's going to help the lymphatic system to start working like normal. Now I'm going to explain you how to do a lymphatic drain massage by yourself. We're going to start and finish the lymphatic drain massage with the neck. In the neck we have the lymphatic lymphos in this area, the ones we're going to work with. And we're going to use our thumbs with as much surface as we can. We're going to start in the low angle of your jaw, where we have the main lympho, and we're going to go all the way down to your neck, to the base of the neck. We're going to do that 3 times. You want to use as much surface as you can, and you want to push a little bit the skin. The pressure is really low because the lymphatic system is just in the surface of the body. Once you finish doing your neck, you're going to start with your face. We're going to divide the face in 5 parts. The first one will be the forehead. So we're going to use our fingers, as much surface as we can like before, and we're going to go from your forehead all the way down from the sides of your face to the jaw and ending up where we started doing the neck. Will be the low angle of the jaw. Then we will do the second part of our face. It will be just between the sides of our nose. We will go all the way to the outside part of the face and again down to the angle of the jaw like the first part. The third part will be above your lip. We will do the same thing with the fingers, using as much surface that we can, get a little bit of your cheeks and all the way down to the same area. The fourth area will be underneath your lip. You will do all the way to the angle of your jaw, and then the last one will be underneath your jaw. You will use your thumbs and you will get all the way back to the main lympho again. Once you've done your face, every part 3 times, you do again your neck. I recommend to do this treatment at least a few times a day. You can do 1 in the morning and 1 before going to sleep. This treatment doesn't increase the bruising in the face, it's just the opposite. It will help to make them disappear. You can use cream or oils, but it's important not to apply too much because then you won't be able to move your skin. Because to do this treatment you have to move a little bit of the skin over the surface of your muscles.